$800 million for programs to help seniors age well. Well, that's all part of a new effort to prepare for Singapore's super-aged society. 1 in 5 people will be over 65 years old within the next 3 years. And 3 ministries will lead in improving the hardware and hardware needed to help seniors age with grace.
The key priority for us in Age Well SG is to recognize that for many seniors, their biggest enemy is social isolation and loneliness. That's when your health really deteriorates. So we want them to be socially included and socially connected with friends, with love, with friendship, with care.
The Health Ministry will open more active ageing centres and improve their programmes and services. That's to help seniors stay active and socially connected to their communities. Some service providers will also be appointed to act as touchpoints for seniors and develop personalised care plans for them. Sabrina Ng with this report.
Side and then back to the centre.
This active ageing centre is big on teaching seniors how to stay fit. After working up a sweat, they can share a hearty meal together, prepared by their peers. These programs keep seniors physically and mentally engaged, but they want more.
Pergi zoo, pergi Sentosa. Jadi bila ada program-program mungkin akan ramai lagi datang ke sini.
To that end, the Health Ministry will bump up each centre's budget by around 50% for upgrading the facilities and expanding the programs and services. Plans are also in place to build more of such centres. But helping seniors to age well beyond the centres is an all-of-society effort.
The resources in the AAC is limited, but if we are able to expand our partnership with like-minded individuals and also like-minded organisations, that will definitely improve our outreach and our engagement to seniors.
Some seniors find themselves having to shuttle between service providers for their care needs.
They may need day care to go in the day, and then when they are not well, they may need home care. We will improve coordination within this aged care landscape. Within each local area, we will appoint a single provider who will coordinate all the services needed for each senior, so that our seniors will have a more seamless journey without having to move from pillar to post.
This single provider will develop individual care plans for the seniors and connect them to all relevant services. But it's not just about what agencies can do for the seniors. Seniors themselves, too, can step up as volunteers to support their peers. A new national initiative will soon be rolled out to train and deploy senior volunteers at AACs. And support for seniors will extend to their caregivers as well. From next year, the government will double the amount of caregiving training grants to $400 per year.
And to give seniors more housing options, Singapore will also build 30 assisted living facilities by 2030. The community care apartments will cater to the changing needs of seniors as they age. And at the same time, improvements will be made in and around existing homes. Sabrina Ng with more.
A space to gather with friends and a fully furnished kitchen. Community care apartments will offer seniors independence and a social life. The assisted living facilities are being piloted in residential towns Bukit Batok and Queensway, and more are on the way.
If the model of care provision proves to be effective and scalable, we'll launch them in different locations across Singapore so that more seniors have the option of moving to our CCAs while remaining in the neighbourhoods that they've grown up in, that they are familiar in.
For those unable to get a community care apartment or who don't want to move out, they can make improvements to their homes instead. A range of services are available depending on what a senior needs. For instance, this foldable grab bar, which can be used to support seniors and tucked away when not needed. These improvements are all heavily subsidized by the government, up to 95%. In public rental flats, an emergency alarm system will be expanded to all seniors aged 60 and above.
You have 10 seconds to record your message after the beep.
For one woman who lives alone, the system has already saved her life.
Then 我又没有 handphone. The only thing is to press 那个 button for help 啊，我就跟他讲，我跌倒了，过不久就有人来打我的门。
Outside of homes, neighborhoods where many seniors live will also get upgrades. For instance, colorful symbols will help them find their way home easily. And all towns will see changes to help seniors cross roads safer.
We will need support from the community and from the rest of our residents when we implement some of these initiatives, is that there will be a trade-off between the speed of traveling and safety.
For instance, longer green lights and measures to slow traffic down.
Foreign manpower concessions in the form of work permit quotas will be given to selected firms that take part in a government trial on new shared stay-in care services for seniors. Now, this will give these companies flexibility in recruiting workers to care for an estimated 800 seniors under the pilot. And the Health Ministry says that it will review the models within the next 2 years. Effective ones will be scaled up. 5 firms are involved in the pilot. They include Red Crown's Senior Living, which was investigated for allegedly flouting manpower laws in June. It was found that Red Crowns managed the deployment of 2 foreign workers who were actually employed by their clients. According to the Manpower Ministry, this means that those clients will be legally responsible if the helpers sustain injuries at work. The Health Ministry reassures that the Manpower Ministry will continue its probe on Red Crowns. It also says that it had assessed the company based on its services and suitability.
We look at things purely objectively in terms of service level, in terms of how much it will benefit seniors, and we shortlisted 5, which included Red Crown, looking at them objectively based on their capabilities and the service level that they managed to deliver in their previous model, albeit it was a model that breached certain MOM rules.
The concession definitely is going to help because it sets up a system for assisted living model to work in the long run. All right. Although, of course, we will appreciate if we can actually have a better ratio. That as in like maybe to have every 2 residents to be able to get 1 foreign caregivers, that would definitely help in the quality of care. However, with this as a start, it is definitely helpful because it will help us to be able to recruit more caregivers